Okay, so let's continue the discussion. So we have here gamma GGT, gamma glutamyl transferase. So this is involved in the transfer of gamma glutamyl residue from gamma glutamyl peptides to amino acids, water, and small peptides. Okay, so in most biological system, glutathione serve as the gamma glutamyl donor. Okay, so its specific physiologic function has not been clearly established, but it is suggested that GGT is involved in peptide and protein synthesis, as well as regulation of tissue glutathione levels and the transport of amino acids across cell membrane. So, what I want you to know about gamma glutamyl, okay, is that this is important, or this is clinically used in the laboratory for the assessment of hepatobiliary obstructions. Okay, so hepatobiliary as well as um, assessment for chronic alcoholism. So, yun yung mga tatandaan nyo dito. GGT, so 2, hepatobiliary obstruction, tumataas siya. So, if that is hepatobiliary obstruction, tumataas siya. Therefore, pag mga liver diseases, okay, liver cirrhosis, hepatitis, tumataas din siya. But this is not the enzyme mainly used for evaluation of such disease. Okay? Instead, ito is for hepatobiliary obstruction. Okay? So again, ano yung dalawang tatandaan nyo for gamma glutamyl transferase? So that is hepatobiliary disorders, hepatobiliary obstruction, as well as alcoholism. Okay, tissue source, kidney, brain, prostate, pancreas, and liver. So expect that there is elevation in case there are damage to the cells present in this organ. Okay? However, nakalagay dito, again, they are confined mainly to evaluation of liver and biliary system disorders. Okay? Liver and biliary system disorders. Kaya nga hepatobiliary disorder. Okay? So, don't forget that one. Elevation. Kailan daw tumataas si GGT? Okay? So, that should be GGT. In virtually all hepatobiliary disorders, making it one of the most sensitive enzyme assay in this condition. Kaya nga sinasabi ko sa inyo, do not forget GGT for hepatobiliary disorders. Okay? So, as well as, kasama na din dyan yung biliary tract obstruction. Okay? So, biliary tract or mga hepatobiliary obstruction. Okay? Okay, so aside from that, another elevations of GGT is for patients who are using warfarin, phenobarbital, and phenytoin. Okay, so for patients wherein these drugs are administered, there will also be an increase in the GGT. Okay, so do not also forget this one. So, mga warfarin, phenobarbital, at saka si phenytoin. So, what's the purpose ba of warfarin? Ito, it prevents blood clots. Ito naman mga anticonvulsant. So, they prevent or they are used to control seizures. Ito, it prevents blood clots. Okay, so if in case again that these are utilized, so expect that GGT levels are increased. That's why clinician also check for administered drugs or drugs used by the patients um, with lab results. Okay, so they check it. So if may elevation ng GGT, okay, so does it mean there's a liver disease or hepatobiliary diseases? So they also check yung mga drugs na ginagamit ni patients. Kasi baka the increased level of the GGT is not because of a disorder, but because of drugs. Okay, so may correlation lagi on the part of clinician. So it's not always. That's why, guys, for us as medical technologists, this is one of the reasons on why we do not diagnose, we do not interpret laboratory test result, because we do not know informations or related information that may be that is maybe a possible cause of increased level ng enzymes or other assays as well. Kaya nga if there are patients that ask for our help on interpretation of the result, mataas ba, mababa, ano bang ibig sabihin nun, please always refer them to their clinicians or their doctors, okay? Do not interpret it for them. Kasi there are cases wherein or there are patients that they will believe you and they will not go to the doctor anymore. Uuwi na sila kasi possible na may additional na bayad for the consultation. So, yung iba nagpapalab test na lang. Okay? So, please do not do that. Always refer test results to the doctor of the patient. Another, alcoholism. Okay? Um, this is also increased in chronic alcoholism. Mataas ang GGT, okay, ng mga taong mahilig sa alcohol, especially if that is chronic alcoholism. Matagal na silang umiinom. That's why this is also useful in monitoring the effects of abstention ng alcohol. So, ibig sabihin, pag matagal nang hindi gumagamit or ni-stop na ni patient yung pagtitake ng alcohol, it would also reflect on the levels of his or her GGT. So, that will return to normal. Okay? Or bababa siya. So, they will know. Okay? Doctors will know if you are telling the truth. Okay? Kung nag-stop ka na ba, nilesen mo na ba, or patuloy pa rin. Okay? Because that will be reflected in the laboratory test result of GGT. Okay? Ito kasi kinapy-paste ko. Okay? Kaya may ACT. Because of this susceptibility to enzyme induction, any interpretation must be done with drugs and alcohol. So you see, take note that with GGT, this is increase in hepatobiliary tract disorder, okay, liver disorder, biliary tract obstruction, use of warfarin, phenytoin, phenobarbital, as well as alcohol intake, especially if they are taking okay alcohol for a long period of time already. So these are also elevated in acute pancreatitis, diabetes, and myocardial infarction. Okay? So possible pa rin na mataas yung GGT with acute pancreatitis, diabetes, okay, and MI. However, clinicians do not usually order this enzyme test assay for the evaluation of such okay, disorders. Okay? So, tumataas lang sila pero hindi to yung ginagamit. Okay? For their evaluation or for their assessment. Again, for acute pancreatitis, ano na ulit yon yung dalawa? Okay? So, you please try to answer me in your minds if you remember it. Ano na ulit? Acute pancreatitis, we have two, si amylase and lipase. Okay? So, sa diabetes naman, what is the lab test for the assessment of this? That is, of course, the blood sugar and HbA1c, di ba? Can you still remember it? Fasting blood sugar and HbA1c. Hindi na kasi common masyadong ginagamit yung OGTT. Diba? So, usually for the OGTT, saan yan usually ginagamit nowadays? For the assessment of what? Gestational diabetes. Okay? Against acute myocardial infarction or heart attack, ano na yung ginagamit ngayon? Troponin test. Okay? So, I hope you got correct answers with those. Okay, punta na tayo sa pinakamabilis na enzyme. That's a joke. Okay? Amylase, ang bilis. So, di ba? Ang corny. Okay? Pero I remember that joke from one of my classmates in acute pancreatitis daw. You have two enzymes. Okay, to remember. Yung pinakamabilis na enzyme at saka yung panulat na enzyme. So, pinakamabilis, amylase. Di ba? Amylase. Okay? Yung isa naman is panulat na amylase, that is lipase. Lapis. Ang corny naman. Anyway, I hope you can remember that one. So, if you do later on, at least, di ba, what you call this one, it help you. Okay? So, sa acute pancreatitis, dalawa, yung joke ni ma'am na corny. So, si amylase and lipase. So, this is the smallest enzyme. Sa function ni amylase, it is more of digestion ng starch. Okay? Digestion ng starch. Okay, so it has two isoenzyme, yung salivary, SNP, salivary and pancreatic amylase. Siyempre, salivary amylase, it digests starch on the oral cavity, sa mouth. Okay? Salivary amylase. Pero kapag nasa digestive tract na siya, okay, pag nasa digestive tract na, that is pancreatic amylase na. Okay? So, pancreatic amylase performs the major digestive action of starch in the small intestine. So, tissue source, as in our cells, sa pancreas at salivary gland. So, if that is the tissue source or major tissue sources for amylase, expect that disorders related to pancreas and salivary glands will increase or would increase the level of amylase in the circulation. There are also lesser concentrations in skeletal muscle as well as in the fallopian tube. Okay, so again, for the diagnostic significance, you have to remember amylase and lipase for the diagnosis of acute pancreatitis. However, again, this is non-specific. Okay, this is non-specific only for acute pancreatitis and is lesser specific as compared kay lipase. Kasi nga, since this is also found in salivary, okay, salivary glands that is produced by salivary glands, both salivary glands and pancreas. Elevations also happen if there are disorders related to salivary glands sa mouth, parotitis, mumps, ganyan. So, tumataas din yung level niya. That's why that is non-specific. Okay? But again, amylase, remember that for acute pancreatitis. However, the degree of elevation is also helpful in the differential diagnosis of acute pancreatitis. Okay? So, it helps. Okay? So, if in case amylase is increased but not lipase, most likely, ano yung disorder nasa mouth, oral cavity, or it can be because of a disorder related to salivary glands. But if both amylase and lipase are increased, then you can correlate that the disorder, the disease, destruction happens within the pancreas. Kaya magkakaroon ng acute pancreatitis. So in acute pancreatitis, both levels must be increased. In salivary gland disorders diseases, only amylase is increased, not lipase. Gets? Okay. So urinary levels and isoenzyme studies, okay, and lipase measurement when used together with serum amylase, okay, increases the specificity of amylase measurement in the diagnosis ng acute pancreatitis. So, ang haba, pero ibig sabihin lang, amylase with lipase, okay, if both assays are increased, then there's a better chance or it increases the specificity that the disorder or disease is found in a pancreas. Okay, so A and L, amylase versus lipase, tatandaan. So AL. Okay, AL. So as you can see here, A, merong A dito, at saka L. Ibig sabihin na uunang tumataas si amylase, mas late tumataas si lipase, and mas longer siyang nagpe-persist. Remains elevated and normalizes, nag-normalize siya after 8 days. Okay? Hindi kagaya ni amylase, tumataas siya 5 to 8 hours, highest level at 24 hours, and bumabalik na siya into normal within 3 to 5 days. Nag-normalize na siya. So, values generally range from 250 to 1,000 sumogi units or 2.55 times the upper limit of normal in case there is acute pancreatitis. So, here guys, again, ito yung sa acute pancreatitis, ha? 5 to 8, peak at 24, normalized 3 to 5 days. Okay, elevated serum amylase level include, yun nga, if the salivary gland is involved, sa mumps, parotitis, as well as intra-abdominal diseases, peptic ulcer, okay, intestinal obstruction, cholecystitis, pag ectopic pregnancy. Kasi if you remember, this can also be found sa my fallopian tube. Therefore, kapag may ectopic pregnancy, tumataas din yung level ni amylase. Okay, mesenteric infarction, acute appendicitis, renal insufficiency, and diabetic ketoacidosis. Okay? So, in hyperamylasemia, okay, eto na nangyayari siya in neoplastic diseases. What do you mean by neoplastic diseases? Guys, what do you mean by neoplastic diseases? Pag sinasabi natin mga neoplastic diseases, there is abnormal mass tissue formation. Yung kapag parang may cyst, either benign siya or malignant. Okay? Basta abnormal mass tissue that forms when cells grow and divide more than they should do. Okay? So, abnormal growth, kumbaga. Okay? So, with elevated results as high as 50 times the upper limit normal. Results when the AMI molecule combines with immunoglobulin. So, amylase combining with antibodies or immunoglobulin to form a complex that is too large to be filtered across glomerulus. Kaya siya tumataas. Okay? So, isoenzymes, again, P and S. So, P, pancreas, S for salivary. Okay? So, yung sa S, isoamylase, aside from salivary glands, sa fallopian tubes, as well as sa lungs. Okay, we go to lipase. Kanina, when it comes to the function, si amylase catalyzes the digestion of starch. Si lipase naman, hydrolysis ng dietary tags. So, lipids naman siya. Okay, so tags means triacylglycerol, or the other name for triacylglycerol, that is your triglyceride. Okay? So, hydrolysis of dietary tags sa intestine to 2-monoglyceride intermediate with the production of long-chain fatty acids. Okay? So, tissue source found primarily sa pancreas. Okay? Lipase. Okay? Lipase found primarily in the pancreas, also present sa stomach and the small intestine. Okay? So, as you can see, kaya nga siya pwedeng gamitin in conjunction with amylase to increase the specificity ng diagnosis. Both lipase and amylase are increased if there is acute pancreatitis. Okay? So, confined almost exclusively to acute pancreatitis yung kanyang diagnostic significance. Okay? Yung usage niya or use niya for diagnostic purposes. Okay? So, it increases 4 to 8 hours. Halos almost the same for amylase, 5 to 8. Okay? Actually, 4 pala siya. Okay? However, it decreased within 8 to 14 days. Okay? So, mas matagal siyang nagpo-persist. Pareho lang pala halos. Guys, 5 to 8 hours, it's the same. Okay? It's almost the same. Pero yung sa A and L, take note that yung lipase, mas matagal siyang nagpo-persist. Ito, nagna-normalize na siya 3 to 5 days, and for the lipase, that is 8 to 14 days. Okay? Bago siya mag-normalize. Okay? So, again, more specific siya as compared to amylase. Both levels rise quickly, but LPS elevations persist for approximately 8 days in acute pancreatitis, while for AMI elevation, nagpo-persist lang siya 2 to 3 days. Yung before this one, yung sa slide kanina, ang sabi is normalizes. So, it returns to normal 3 to 5 days. Nag-normalize na siya. Okay? So again, lipase, do not forget acute pancreatitis. So it also increases in intra-abdominal conditions, but with lesser frequency as compared to serum amylase. Kasi nga, serum amylase is also found sa mga salivary. Pero sa here, mga intra-abdominal conditions, ibig sabihin for serum amylase, mas elevated siya as compared kay lipase. So, both penetrating duodenal ulcers, perforated peptic ulcers, intestinal obstruction, and acute cholecystitis, lipase is also increased. So, in all of these diseases, okay, your amylase also is increased. Okay? mga ulcer, intestinal obstruction, and acute cholecystitis. So, mataas din ang amylase. So, both amylase and lipase are elevated in these conditions as well. Okay? Lipase levels are normal in conditions involving the salivary gland involvement. Kaya it can amylase test can together with your lipase can determine if that is salivary or acute pancreatitis. Again, sa acute pancreatitis, both are elevated. Mga salivary gland involvement, only amylase is elevated. Mga peptic ulcers and acute cholecystitis, um, as well as intestinal obstruction, both are increased. Okay? So, don't forget those. Isoenzyme, so L1 to L3, pero L2 daw yung most clinically specific and sensitive. Okay, so we're done with 3 amylase, lipase, and GGT. Again, sa GGT, mga hepatobiliary tract obstruction, chronic alcoholism, what else? Yung use of warfarin, phenobarbital, at saka si phenytoin. Okay? We go to G6PD. So, ilan pang enzymes to? G6PD and other clinically significant enzymes. So, medyo marami-rami pa. 20 slides, 25 slides. Okay, so anyway, let's continue para matapos na rin. So, we have here glucose 6-phosphate dehydrogenase. Okay, if you hear this one, what cell of the body should you remember? That is your red blood cell. Okay. So, your G6PD, that is an oxidoreductase that catalyzes the oxidation of glucose 6-phosphate to 6-phosphogluconate or the corresponding lactone. Okay, tissue source, adrenal cortex, spleen, thymus, lymph nodes, lactating mammary gland, and erythrocyte. Okay? So, yung clinical significance kasi niya, kaya sinabi ko kanina na kapag narinig nyo to is you should remember erythrocyte because that is related to our discussion today. Okay? Kasi nga, in our discussion, yung sa erythrocyte, yung nagmamatter, yung sa discussion natin. Okay, so especially sa diagnostic significance. So we have it here. Diagnostic significance. So red blood cell, it maintain NAD pH in the reduced form. Sorry, that is our water supply. NADPH that is required to regenerate sulfhydryl-containing proteins kagaya ng glutathione from the oxidized to the reduced state. So glutathione in the reduced form in turn protects hemoglobin from oxidation by agents that may be present in the cell. So basically, ang dami-dami niyan, pero ang ibig sabihin lang niya is si G6PD kasi it protects the cell, okay? So, glucose 6-phosphate dehydrogenase, okay, is important in the pathway that maintains the cell, okay, so that it is safe from oxidative stress. Okay? Basta yun yung pinaka-main purpose niya. Tinutulungan niya. We are talking about red blood cell here, ha? It helps in protecting the cell from oxidative stress caused by yung mga hydrogen peroxide. Okay? Basta yung mga nagko-cause ng oxidative stress, mga oxidant. Okay? So, yun yung pinaka-purpose niya as enzyme. Again, though in reality, di ba, they do not enable, but they only catalyze the chemical reaction. But again, it will take years for chemical reaction to happen without this enzyme. So, parang basically, sila talaga din. Without them, the chemical reaction will not happen. Okay? Because of the time it will take for this chemical reaction to happen, diba? So, elevations ng G6PD, myocardial infarction, as well as sa megaloblastic anemia. Bakit siya tinatawag na megaloblastic? Mega, malaki. Okay? Malalaki yung mga cells, macrocytic. Okay? Macrocytic. So, under parasitology, when do you see macrocytic red blood cell as a result of anemia? Kapag may vitamin B12 deficiency. And what parasite causes vitamin B12 deficiency again? Diphyllobotrium latum. Diba? How about for microcytic anemia, yung sa IDA, iron deficiency anemia? Anong parasite naman ang possible mag-cause ng IDA? Mga hookworm, Negator americanus, at saka sila Ancylostoma duodenale. Okay? So, kapag IDA naman, hookworm infection, ano yung i-expect mo sa morphology ng cells? Hindi siya macrocytic, instead micro, maliliit, microcytic anemia, okay, for hookworm infection. Okay, so that is correlation. So here naman with G6PD, tumataas daw siya pag myocardial infarction at saka megaloblastic anemia. But then again, the G6PD measurement is not routinely performed for the diagnosis of these conditions. Okay? So that is not the main assay for the evaluation ng mga sakit na to. Okay? No elevations are seen in hepatic disorder. Okay? So, ibig sabihin si G6PD hindi daw tumataas kapag mga disorder related sa liver. Okay, kailan bumababa yung level ng G6PD? Okay, pag may G6PD deficiency, of course. So, this is actually an inborn error of metabolism wherein there's a mutation sa genes, okay, resulting to the absence of these enzymes, okay, in the red blood cell. Okay? Or not only in the red blood cell but as well as in the other parts of the body. A deficiency of G6PD results in an inadequate supply ng NADPH and ultimately the inability to maintain reduced glutathione levels. Okay? So, if your body cannot maintain glutathione levels at your reduced state, it cannot protect itself, okay, from oxidant stress caused by hydrogen peroxide as well as other oxidants. So if that's the case, if your RBC is subjected to oxidative stress or mga oxidants, ano mangyayari? The red blood cells will be hemolyzed, masisira, mabibreak. Okay, that will lead to hemolysis. Nakukuha, leading to what? Increase or decrease? G6PD. Not affected kasi wala ngang G6PD na yung cells mo. Okay? So, wala nang G6PD. So, kahit mabasag-basag pa yung mga red blood cells, what will happen? Okay? Mababa pa rin. Kasi nga, wala namang G6PD yung red blood cell. But in a case wherein you don't have G6PD, nahimalize yung cell, red blood cell, expect an increase in the level of the G6PD. Okay, it can result in several different clinical manifestations like drug-induced hemolytic anemia. Okay, so in persons with G6PD, okay, so in persons with G6PD, if uh, drugs are administered to them, mga oxidant drugs, they cause oxidative stress kasi sa red blood cells natin. Okay? However, in normal individual without G6PD, since meron naman siyang reduced glutathione that deactivates yung mga oxidants, parang wala lang, not affected. But in case may G6PD si patient, okay, walang mag-neutralize, okay? Walang magdi-deactivate or mag-neutralize ng mga oxidative stressors or oxidants. Okay? Therefore, that will lead to hemolytic anemia. Drug-induced hemolytic anemia kasi nga, okay, the hemolytic anemia was caused by drugs. What are the drugs that may cause drug-induced hemolytic anemia with G6PD deficient individuals? Okay, primakin, okay, so usually mga primakin. So, ano ba itong si primakin? This is utilized for, for treatment ng malaria infection. O, di ba? Related sila sa parasitology. Okay? That's why, in cases of G6PD deficiency individual, okay, alternative medicines are given. Okay, instead of primakin. Okay, kasi nga this is an oxidant drug. Okay, pag walang G6PD sa red blood cell, what will happen to the individual? He will or she will experience hemolytic episode, hemolysis. So, what are other examples ng mga oxidizing agent? Acetanilide, furanolidine, isobutyl nitrate, nalidixic acid, naphthalene. Okay? Naphthalene, nirasidazole, as well as sulfa drugs. Okay, so do not also forget these drugs because these are oxidizing agents. Another, fava beans. So we have here an illustration, favism. Okay, pag mga naririnig niyo yung favism, dapat pumapasok mo sa isip niyo yung sa G6PD deficiency. Okay, kasi this fava beans, it contains oxidant, okay, oxidizing agent. Okay, if that is ingested by a person with G6PD deficiency, okay, they may experience hemolytic episode. Okay, so as you can see, we have here a doctor. So G6PD deficiency, Favisa. That's the title. Okay. So what did you eat, dear? Wow, parang si Ma'am Susie. Dear. Okay. So this is the mommy and this is the child. Nothing. Wala daw. Nothing, just 2 bean pitas and 5 falafel sandwiches. And this food, nothing. Pero imagine mo, dalawa, tapos 5. That's already saved. Ang dami-dami, no? Okay? So, this contains yung fava beans. Okay? So, eto pala yung unang conversation. What did you eat, dear? Okay, or eto, nauna pala si mom. Okay, Doc, my kid is turning yellow and his urine is dark. Okay, in this case, what comes into your mind if you hear this scenario? There's a possible hemolytic episode. Okay, nagyayelo na, nagjo-jaundice na, nag meron ng increased level ng conjugated uh, and unconjugated bilirubin. Basta, there is an increased level of bilirubin. Pag mataas ang bilirubin, what would you expect? Nagyayelo ang isang individual, di ba? Okay? Aside from that, nagiging dark ang kanilang urine because of the excretion of bilirubin. Okay? So, nagyayelo na daw yung kanyang anak. So, the doctor asked, what did you eat, dear? Okay, namali si ma'am ng start ng flow ng story. So nothing, just 2 beans of pitas, 5 falafel sandwiches, and this contains fava beans, which causes hemolytic episode for children or for individuals having G6PD deficiency. Kasi nga, it contains oxidizing agent, yung fava beans. Kaya meron silang diet restriction for kids with G6PD deficiency. Okay? They have diet restriction. So do not forget this one, favism, G6PD deficiency. So here, wow, this is an erythrocyte. Okay, bakit kaya iba yung ano? Okay, iba na yung kanyang structure. Okay, so we have here, di ba glucose? If you remember glucose, that is for ATP, di ba? ATP generation. Yung asukal. Okay, glucose. So if you remember yung mga pathways natin, glucose will be converted. So this is a glycolysis. First step pa lang to. Glucose 6-phosphate. Okay, so your glucose 6-phosphate together with this enzyme your G6PD, glucose 6-phosphate dehydrogenase, it will catalyze the formation of 6-phosphogluconate. Okay? 6-phosphogluconate. So si G6PD magiging 6-phosphogluconate with the catalyzation effect of your glucose 6-phosphate dehydrogenase. But in your erythrocyte, the G6PD also together, ha? So this happens together. So your G6PD will be converted to 6-phosphogluconate plus your NADP will be reduced to NADPH. Magiging NADPHC and ADP. So it happens at the same time. Okay, G6P to 6-phosphogluconate, your NADP will become your reduced NADPH. Okay? So, in the erythrocyte, your NADPH is a cofactor, remember? Organic cofactor siya for glutathione reductase to convert, okay? Oxidized form ng glutathione. This is glutathione, GSH. This is oxidized glutathione, okay? So this one will act as a cofactor in the what do you call this one? In the reduction of your oxidized glutathione para maging glutathione siya. Okay? So, eto yung enzyme. So, without this one, okay? So, eto kasi yon pag kinakat mo to, for example, walang G6PD, in G6PD deficiency, so your NADP will not be reduced to NADPH. Makakat lahat tong process na to. Okay? So, wala na to, makakat na siya. Kasi nga wala kang G6PD na enzyme, which is important para ma-convert si NADP to reduce NADPH. Si NADPH that acts as a cofactor for the oxidized, okay, oxidized glutathione to become your glutathione. So, what is the action of glutathione? Okay, so glutathione, okay, with the help of glutathione peroxidase, okay, so it catalyzes the conversion ng oxidant stressors kagaya ng hydrogen peroxide, primakin, mga naphthalene drugs, what else, acetanilide drugs, to water. So this is an oxidative stressor in the red blood cell. Accumulation or high number of this one will lead to hemolysis. Okay? Kasi nga hindi na na-maintain yung membrane integrity ng red blood cell kasi meron kang oxidant stressor. Okay? So, i-stress nila hindi ma-maintain yung integrity ng red blood cell membrane leading to hemolysis. That's why this is important. Without this, these reactions will not happen. And if these reactions will not happen, expect a high level of oxidant stressor, kagaya ng hydrogen peroxide, leading to hemolytic episode. Nakukuha? Nagigets? Okay, so we have here another image. Okay, so here, so aside from that, your glucose 6-phosphate dehydrogenase, okay, maintains your hemoglobin into ferrous state. Okay? So, this is the normal, di ba? So, methemoglobin, eto na yung ferric state. Okay? Accumulations of your hydrogen peroxide lead to hemoglobin denaturation as well as formation ng Heinz bodies. So, these are hemoglobin particles. Okay? Membrane lipid peroxidation and hemolytic anemia. Okay? So, pag may methemoglobin, okay, mataas yung level ng hydrogen peroxide. Okay, so leading to hemolytic anemia. So this one, if high levels of this is happens in your red blood cell, that will lead to hemolytic anemia. Okay, so again, we have here your glucose 6-phosphate. Okay, glucose 6-phosphate produces or what do you call this one? Balikan nga natin yung iba kasi yung ano niya. Glucose 6-phosphate is important for the liberation ng NADPH. Okay? So, eto kasi mali siya dapat dito. So, glucose 6-phosphate, okay, converts your G6, glucose 6 phosphate into 6-phosphogluconate as well as reducing your NADP to NADPH, di ba? Okay, in turn, your NADPH is a cofactor to convert oxidized glutathione to your reduced glutathione. Your reduced glutathione will, okay, reduced glutathione together with your glutathione peroxidase, this enzyme will deactivate or convert this oxidant stressor, okay, or this oxidative agent, to a non-harmful compound, which is your water. Nagigets? Okay, so kung dito pa lang wala na to, wala na napoproduce na NADPH, hindi na mangyayari itong mga chemical reaction. There will be accumulation of your hydrogen peroxide. Okay? So I hope hindi nyo makakalimutan yun. So we move to other clinically significant enzyme. We have the 5-nucleotidase. Okay, so phosphoric monoester hydrolase, predominantly secreted from the liver, It is also a marker of hepatobiliary disease and infiltrative lesions ng liver. Hepatobiliary disease as well as infiltrative lesion. Okay? Kahit yun na yung tatandaan nyo. 5 nucleotidases, hepatobiliary disease, and infiltrative lesion ng liver. Pseudocholinesterase. What I want you to remember about this one is organophosphate poisoning and mga insecticide poisoning. Okay, so again, for pseudocholinesterase, pseudo kasi it's like false. Okay, false cholinesterase. But for cholinesterase and pseudocholinesterase, what I want you to remember about this enzyme is that it is used for the assessment ng poisoning, insecticide poisoning or mga organophosphate poisoning. And aside from that, what I want you to remember is that among the different enzymes, ito lang yung enzyme na bumababa yung level niya. Okay? Yung normal level kaya kasi is parang around 2,000 to 4,000 something. Pero kapag may mga insecticide poisoning, that's less than 1,000. Okay? So, yun. Tatandaan nyo, insecticide poisoning and decreased value of the enzyme. Okay? So, poisoning and decrease in value. Secreted by the liver, it reflects synthetic function rather than hepatocyte injury. Okay? So, it catalyzes the removal of benzyl group from cocaine. It also acts as anti-xenobiotic enzyme. Okay? So, what do you mean by anti-xenobiotic enzymes? So, ito yung mga enzymes wherein they are involved sa elimination and detoxification of exogenous agent. Okay? So, they detoxify drugs. So, what are these anti-xenobiotic enzymes? So, these are drugs, okay, that eliminates and detoxifies exogenous agents. Okay? Yung mga drugs coming na ini-intake natin. So, dinadetoxify nila yung mga yon. So, that is a marker for insecticide, okay, or pesticide poisoning, okay, or organophosphate poisoning. Again, ano yung level nila? Pag may poisoning, mababa. So, pag mataas, walang poisoning. Okay? Ganun yun. So, aside from that, that is used to monitor the effect of muscle relaxants or succinylcholine after surgery. Ito yung mga anesthesia. Okay? So, it is used to monitor effect ng mga muscle relaxants. Okay? So, included also pseudocholinesterase, organophosphate poisoning, mababa. Okay? Also, monitor ng mga anesthesia or mga muscle relaxants, kagaya ng succinylcholine. Okay? Pseudocholinesterase sources, liver, heart, pancreas. So, that is decrease in acute hepatitis, cirrhosis, carcinoma, metastatic to liver, and malnutrition. Okay? So, ma'am, hindi lang naman pala siya sa organophosphate poisoning. However, again, your pseudocholinesterase is not usually requested for the assessment of this condition. Okay? Hindi kasi siya yung nire-request. So, for cases na they think that a patient nag-suicide or yung mga effects ng long-term exposure sa mga factories, ganyan. Okay, so they can use the pseudocholinesterase or acetylcholinesterase levels to assess it. Okay, yung may mga long-term exposure sa insecticide, okay, or pesticide, mga factory workers, okay, as well as sa mga suicide cases. Okay? So, your pseudocholinesterase reflects acute toxicity. Okay, acute toxicity, kumbaga toxic, mabilisang nangyari yung toxicity. While for acetylcholinesterase, this is your true cholinesterase. Ito kasi parang false cholinesterase, kaya nga siya pseudo. Okay? In the red blood cells, better reflect chronic exposure. Okay? So, long-term exposure to organophosphate naman. Pag yung si acetylcholinesterase or the true cholinesterase, Another, we have here angiotensin converting enzyme. So, converts. Yun lang yun. It converts angiotensin to angiotensin 2. Simple as that. It is a possible indicator for neuronal dysfunction kagaya ng Alzheimer disease. So, kahit yan lang yung tatandaan nyo. Possible indicator. Okay. As well as, aside from this, possible indicator ng neuronal dysfunction. Okay, so, and its diagnostic significance is for the diagnosis and monitoring ng sarcoidosis. Pag sarcoidosis, that is a disease characterized by the growth of tiny collection ng inflammatory cell. Okay? So, may growth ng inflammatory cells or yung mga granulomas in any part ng katawan, most commonly sa lung at saka lymph nodes. Okay? Granuloma. Okay? Inflammatory cells. Sarcoidosis, angiotensin converting enzyme. Okay, this is a critical target for inhibitory drugs designed to lower blood pressure. Okay, so increase sa sarcoidosis, multiple sclerosis, Addison's disease, acute and chronic bronchitis, HIV infection, as well as sa leprosy. Okay, sa ceruloplasmin, this is the last one. Yehey, malapit na tayo sa katotohanan. So, sa ceruloplasmin naman, this is a copper-carrying protein and also an enzyme. So, this is a marker for Wilson's disease. Yan naman yung gusto kong tandaan nyo for ceruloplasmin. So, kumbaga, it's a carrier ng copper. Yung ibig sabihin nun, it carries copper within the circulation or within the body. Okay, yun yung ibig sabihin niya. Therefore, si ceruloplasmin nagko-combine siya with copper. Same with haptoglobin. Si haptoglobin, yan yung carrier protein ng hemoglobin. Okay? So, yan yung carrier protein ng ating hemoglobin. Nakukuha? So, si copper naman, ang kanyang carrier protein is the ceruloplasmin. So, yan yung marker for Wilson's disease. Ano yung level niya sa Wilson's disease? Mababa. Okay? Mababa because of the high level of copper in the body. So, pag masyadong mataas yung copper sa body, nasaan na yung mga ceruloplasmin? Naka-attach na sila kay copper. Okay? Okay? So, aside from pseudocholinesterase pala, kasi di ba mababa siya sa organic poisoning, same with sa Wilson's disease, si ceruloplasmin mababa din. Okay? Mababa din siya. So, bakit ko kanina ba sinabi? Kasi nakalimutan ko meron pa pala tayong ceruloplasmin. Even sa haptoglobin, pag mga hemolytic episodes, mababa yung haptoglobin. Okay? Kasi nagbabound na sila kay hemoglobin. Basta guys, ceruloplasmin, that is a copper carrier. Okay? So, in Wilson's disease, high level yung copper. Okay? High level yung copper. That's why nagkakaroon ng deposition. Hindi din sila usually hindi siya na-excrete sa katawan. Kaya nagkakaroon ng accumulation. Okay? Accumulation of copper in the body. Okay? Wilson's disease, high copper, low ceruloplasmin. Okay, so we have here Wilson's disease. Kaiser-Fleischer rings. Nagkakaroon ng Kaiser-Fleischer rings. So, nagkakaroon kasi ng depositions of copper around the eye area. Yung part ng eye na to. Okay? So, aside from that, nagkakaroon ng osteopenia and liver cirrhosis. So, in persons with Wilson's disease, if there's a liver cirrhosis, expect high levels also of AST and ALT. Even for yung mga GGT, kasi diba present din sila sa liver. Pero pag mga elevations talaga, mas nagre-reflect yung sa AST and ALT because of higher elevation as compared sa GGT. Okay? So, meron mga liver cirrhosis. Okay? Yung mga persons with Wilson's disease. Yung iba nagde-develop into liver cirrhosis. So, the first symptoms result from brain damage. Okay? Ng Wilson's disease. Nasisira yung brain. Nagkakaroon ng tremor, difficulty of speaking, swallowing, drooling, and coordination, jerky movements, even personality changes, psychosis as well. Diba? Nagkakaroon ng schizophrenia and manic depressive illness. Okay? So, first symptoms usually hepatitis. Okay? Liver inflammation. Di ba pag naririnig natin usually ang hepatitis is because of yung hepatitis virus. But it's not. When we say kasi hepatitis, okay, there's an inflammation of the liver. Okay? So, nagkakaroon din ng hepatitis and that eventually leads to scarring. Okay? Or sa cirrhosis. A gold or greenish gold rings, termed as Kaiser-Fleischer rings. So, pag naririnig nyo yan, di ba, ang dapat naalala nyo dyan is Wilson's disease. Kaiser-Fleischer rings. Okay? So, around the iris ng eye. So, I forgot iris pala yung tawag doon. Okay? Pupil iris. Tama ba? So, these rings develop when copper accumulates. So, yung ring na yun is because that is a copper. In a few people, these rings are the first sign ng Wilson's disease. So, ano yung mga first signs and symptoms? Okay? So, you have hepatitis and yung sa case or Fleischer rings. So, diagnosis, okay, pag nagkakaroon ng hepatitis, tremors, personality changes, okay, without no obvious other cause. So the following tests help confirm the diagnosis. Slit lamp examination to check for the rings sa eye area. Blood test to measure level of ceruloplasmin. Okay? Ano yung expected level? High or low? Low. Okay? Low. Pero pag mga copper, anong level ng copper? High. Measurement of copper excreted in the urine. So, copper, mataas of course. If the diagnosis is still unclear, a liver biopsy is needed. So, eto yun, yung parang ring. Okay? So, nagba-brown na siya because of the copper. Okay? So, astig. Kakaiba, di ba? So, you can see, nagkakaroon ng brown coloration outside ng iris. Okay? So that ends our discussion. I hope you review well and I hope you were able to learn a lot from me. After all, di ba, I'm your instructor. I'm paid to do so. Di ba? So, hopefully worth it naman yung 56,000. Okay, so please review well for your quiz. I wish you well. Please do good. Okay, you give your parents what is due to them for paying 56,000. Okay, for your tuition fee. So please, please, please lang mag-aral kayong mabuti. Okay, so I wish you all a high result of a high quiz result. Okay, so God bless everyone and see you again tomorrow or in the next coming days.